Introducing lasting change in an orthodontic practice is notoriously difficult, not because we lack the desire to improve, but because we are constantly fighting the invisible gravity of long-standing habits. These deeply ingrained, often unconscious processes dictate every single aspect of our clinical day, from how the sterilization protocol flows to the specific way a complex treatment plan is presented to a family. As orthodontists, we often focus intensely on the habits of our patients, such as thumb sucking or tongue thrusting, yet we rarely turn that diagnostic lens toward the habitual patterns that define our own professional lives. These institutional habits form the invisible architecture of your clinic, and without addressing this structure, any attempt at systemic improvement is destined to fail under the weight of the status quo. In the world of high-level lean orthodontics, professional growth is about more than just mastering a new surgical technique or a digital workflow. It is about creating new, superior habits that allow your practice to eventually run on autopilot. This philosophy requires a profound shift in your leadership mindset, moving from a state of constantly putting out operational fires to a state of engineering consistent, predictable processes. By doing so, we maximize the value for the patient while simultaneously minimizing the wasted effort, time, and cognitive energy across the entire team. To transform your clinic into a high-performance machine, you must first understand the underlying mechanics of behavioral change and how to harness them. By utilizing the principles of behavioral science, we can move away from reactive decision-making and toward a state of practice efficiency, where high-quality care becomes the baseline, not the exception. We do this by mastering the three-step habit loop, which consists of a cue, a routine, and a reward. To implement a new clinical standard, you must intentionally design each part of this loop to ensure it fires reliably for every team member, regardless of how busy the schedule becomes. The cue is the specific trigger that tells the brain to enter automatic mode. It must be explicit and sensory, the moment you look into a patient's mouth or the sound of the next patient being called into the bay. The routine is the action itself, the behavior you wish to automate. For this to work in a high-volume setting, the routine must be simple, precise, and easily repeatable to reduce the cognitive load on your staff. Finally, the reward is the positive reinforcement that tells the brain the routine was successful. In our world, the reward is often the immediate clarity and professional confidence of knowing exactly which direction a treatment is headed without the exhausting need to second-guess yourself. When a front office manager sees an error-free billing cycle or receives positive patient feedback linked to their efficiency, that sense of achievement cements the habit loop for the future. We can apply this loop directly to clinical diagnostics through what I call the Baxmann keys. This diagnostic framework is an essential routine for minimizing variability between doctors, especially when you are training new associates or scaling multiple locations. The trigger is the initial examination of the patient's occlusion and profile. The routine is to look immediately at three specific anchors: the canine relationship, the molar interdigitation, and the midline. By prioritizing these three markers, you establish the patient's skeletal and dental classification with high accuracy in just a few moments. This structured approach prevents the common trap of getting lost in minor, less therapeutically relevant details during the early stages of an exam. Training your brain to seek these anchors instinctively allows you to grasp the entire clinical situation in seconds. If the canines are class 2, you immediately recognize the therapeutic path, streamlining your decision-making for appliance selection, anchorage requirements, and treatment phasing. This speed does not just improve your practice efficiency, it releases a burst of endorphins because you feel in total control of the clinical outcome. That sense of mastery is the powerful, intrinsic reward that ensures you stay high-performing even on your busiest days. This internal satisfaction is far more effective for long-term behavior change than any external incentive could ever be. This habit engineering extends far beyond the doctor's chair. It must encompass the entire patient journey. Optimizing the journey through structured habits significantly enhances your reputation and reduces the administrative ballast on your team. For instance, when a patient schedules a diagnostic appointment, that is the cue. The administrative routine is then an automated sequence: confirmation emails, medical history forms, and office directions. The reward is a patient who arrives prepared and informed, which allows you to start the exam promptly and maintain the integrity of your schedule. By setting up these triggers, you create a system where the patient feels cared for with zero manual effort from your clinical team. True dental leadership involves guiding your team to develop these process chains and modeling these high-performance habits yourself. This is how a clinic transitions from being merely managed to being genuinely self-organizing and resilient. When standard problems are connected to standard strategies, you save your precious mental energy for the truly complex cases that require your full expertise. This preserved mental bandwidth is the key to strategic planning and visionary growth. By engineering positive habits into your daily routine, you ensure your practice evolves constantly. This commitment to habitual excellence provides a better experience for everyone involved, while providing you with a significant competitive edge in the marketplace. Thank you for your time, and I'll see you in the next video.